Hi everyone, today we are doing a lifting thread procedure on this patient. This is actually her first cosmetic procedure besides just getting her normal maintenance Botox. So this is a really exciting day for her. For her, we are focusing on that lower half of the face. This is the area that bothers her, and she always kind of comes in and she places her hands like up on her cheekbones and pushes back the skin and says, I wish I could just pull back and tighten. So that is exactly what we're doing here with lifting threads. This is not a surgical facelift, so patients do have to have realistic expectations. But for the right patient and for someone who is realistic with the amount of lift that we are going to get, have fantastic results. So she actually had a really nice before and after. We're going to put that at the end of the video. And afterwards, like after this treatment, the first before and after you're going to see is about 3 weeks after her healing process, after getting this treatment. And then we filled her cheeks and her nasolabial folds. There's an immediate after photo of that. But we are going in and starting with our numbing. I have 2% Lido with Epi for my insertion point. I really find that using Lido with Epi helps with that initial bleeding at the insertion site and just makes your treatment a little bit cleaner. I do this without an assistant, so it does make it a little bit easier if the patient isn't bleeding everywhere. But I'm going into each of my vectors and making sure I have a good starting off point for my cannula. We chose to do 2 vectors to her nasolabial fold because this is the area that really bothers her. Her left side was a little bit more deficient as well. She does sleep on that side, so that is probably the reason why. But we chose 2 vectors just for a little extra lift. But here I am going in with my cannula and just making my way down all the way past that nasolabial fold. For pretty much all treatments in the nasolabial fold, I like to go all the way past that area of animation to get the best lift. Sometimes if a patient has really full cheeks naturally or has had filler, it is a little bit more difficult to go all the way past that nasolabial fold. So sometimes I will stop right before, but it is very important to not stop right in the fold. Just because when a patient's smiling or when they're talking and they're expressing, it is a higher chance that you'll be able to see the end of that thread right in that crease. So always make sure you're going all the way past that deficit or stopping right before. But I am just repeating the same process and going all the way down my vectors. People always like to comment that we make it look really easy with our cannula here. I promise cannula is just a certain feeling. Once you get it, it is a very smooth and easy treatment. It just does take some practice to get comfortable using a cannula versus needle. If you use cannula for filler and you haven't done this procedure before, you probably will have a little bit of an easier time navigating through that tissue with the cannula if you do have experience, but it is a relatively quick and easy treatment. Even though it does look a little bit more invasive than some other treatments, I promise that the patient is comfortable. Now we are going in with our thread. We chose 17 by 100 threads for her. These are the heaviest threads that VSoft Lift has to offer, and these are my favorite for getting the most dramatic result. I give that end a little twist just to make sure my thread is engaged and pull back. And as you can see, it's fairly simple here. I'm going down and repeating that same process for my second vector here, both going to that nasolabial fold. But like I said, 17 gauge tends to be my favorite. If the patient has thinner skin or maybe a Fitzpatrick 1 or 2, sometimes I stray away just to prevent any thread visibility. But other than that, I really, really like this thread. This is one of my favorites. But here I'm a little stuck, and that's totally okay. Sometimes you just have to give it a little extra oomph. You are going through ligaments when we're down in that subdermal plane, which is what you want to feel. So sometimes some areas are just a little bit more difficult than others. But Just coming out of that one and going ahead and going on to my next vector. This treatment takes about 30 to 40 minutes depending on if you have an assistant or not helping you draw things up. But all in all, I would say it takes about 30 to 40 minutes, just depending on how many threads that I am placing. And once you get the hang of it, it is, like I said, a pretty straightforward procedure. And she in particular did get some really, really great results. She is a good candidate for lifting threads. She's in her late 30s, early 40s. She is just starting to see kind of that volume loss in her cheeks, leading to the jowling, deeper nasolabial folds, marionette lines, things like that. She's just at the beginning of that. So this is a really nice preventative treatment for her to help stimulate and build collagen. We typically do maintenance for threads around 9 to 12 months just to keep stimulating that collagen as the patient ages. So this is her first time, so I'm very excited to kind of continue working with this patient and keeping up with threads and other collagen stimulating treatments as well. And we did see her back in 3 weeks, and we did cheek filler as well as a little bit in her nasolabial fold. But this looks a little bit aggressive, but I promise I am not hurting her too much. I am putting quite a little bit of pressure there to pop those threads into place and make sure they are fully engaged. But this is relatively comfortable. I do know it looks a little bit intense, but I promise that the patient, she has lidocaine, she is numbed, she is doing just fine, and she is very happy with her results, and she is already planning on coming back in 9 to 12 months to do another round. But we are now going to go back in and do a jawline. I wiped off my marking here, so I'm just going back in and marking off my antegonial notch where that facial artery comes up. You can't cause an occlusion or compression with threads. However, you can give the patient a pretty decent sized bruise or hematoma if you nick any major vessel or any vessel at all. So we want to avoid that as much as possible. Sometimes it's unavoidable and they do end up with a bruise, but I do try my best to avoid it if I can. I do tell patients to not have any special events for at least 2 weeks, if not 3 weeks, just because this is a treatment that we do tend to see a lot of bruising and swelling. Not only from that initial insertion site, but the threads are barbed. So oftentimes the patient will get a little bit of bruising down that vector. So I just make sure that the patient doesn't have anything special coming up or they're going to be in a lot of photos or anything like that. They can apply makeup after 48 hours. However, most patients probably won't want to be covering up bruises for any, special events coming up in the first couple of weeks. So just make sure they're aware prior to treating. So I'm just finishing up my last vector on this side, which is a jawline, just to help with that marionette line. And again, just kind of help snatch right along the jawline. Same process, going in and doing some 2% lidocaine just to help numb that tract, and then going in with my thread. Once I'm finished up with this vector, I am going to pop on a Band-Aid and move to the other side. But overall, the healing process for this treatment takes about 2 to 3 weeks for complete healing, for all of that bruising and swelling to go down. I have my patients keep those Band-Aids on for the rest of the day. No makeup or sweating for at least 24 to 48 hours. For infection purposes, I want those sites to be completely clean. I tell them to avoid any intense exercise for the next few weeks. They can walk, jog, normal workout routine. I tell them to avoid just any heavy weightlifting, CrossFit, things like that. But other than that, she got an amazing result, and we will put those before and afters here at the end.